Hemophilia is a bleeding disorder, also known as the royal disease, since this condition affected many European royal family members back in the 19th and early 20th centuries. This disorder descended from Queen Victoria, who carried the mutated gene, and subsequently passed it down the bloodline. The mutated gene continued to be passed down due to affected kin intermarrying for political gain, which resulted in many generations of royalty afflicted with hemophilia. In fact, many members of the royal family who had hemophilia eventually died from hemorrhaging after sustaining normally survivable falls. Today, there's no known living members of the dynasties of Europe that is believed to carry the gene for this disorder. So, what exactly is hemophilia? Hemophilia is a rare inherited blood disorder that can lead to spontaneous bleeding after any injury or damage. In normal clotting, also known as coagulation, following an injury to a blood vessel, clotting factors are proteolytically cleaved, and the activated protein then activates the next clotting factor, and so on. Eventually, prothrombin is converted to thrombin, which then acts to convert fibrinogen to fibrin. Fibrin forms a mesh that traps red blood cells and platelets to the injured area, forming a clot. Once the injury starts to heal, fibrinolytics will break down the clot. People with hemophilia have low levels of certain clotting factors, either factor 8 or factor 9 in congenital hemophilia. Hemophilia A is associated with low levels of factor 8, while hemophilia B is associated with low levels of factor 9. Although it is common for this disorder to be inherited, it can also develop later in life, like in those with autoimmune conditions or during pregnancy, and this type of hemophilia is called acquired hemophilia. Acquired hemophilia usually can be resolved with treatment. The cause of hemophilia is a mutation in a gene on the X chromosome. This disorder is more commonly found in men than women because it is a sex-linked recessive disorder. Since males only have one X chromosome, they only need one affected chromosome to have this disorder. Women have two X chromosomes, so they need two affected chromosomes to have hemophilia. Women can be carriers of the hemophilia gene, meaning they have one affected chromosome but do not exhibit the disease phenotype. Hemophilia is commonly passed from mother to son. Because hemophilia affects blood clotting, symptoms of hemophilia include a lot of bleeding, such as bleeding into the skin causing bruising, bleeding of the mouth and gums, bleeding after circumcision or getting shots, blood in the urine or feces, frequent nosebleeds, and excessive bleeding even after small cuts. Severe symptoms of hemophilia include bleeding into the joints, which can lead to swelling, chronic joint disease, and pain. Bleeding in the head or brain can cause seizures or even death. Bleeding into other vital organs such as the heart or the lungs may cause death as well. Blood tests are generally used to diagnose hemophilia. These blood tests are to see if the blood is clotting properly. Clotting factor assays may also be done to show the type and severity of the disease. If a newborn has known relatives with hemophilia, they will be tested for the disease once they are born. Otherwise, tests are done after the patient exhibits symptoms of hemophilia. The primary way to treat hemophilia is to replace the missing clotting factor by injecting clotting factor concentrates into the patient's vein. There are two types of clotting factor concentrates used for treating hemophilia: plasma-derived factor concentrates and recombinant factor concentrates. Plasma-derived factor concentrates contain clotting factors that were separated from human blood plasma. They are tested for viruses before it's packaged for use. Recombinant factor concentrates are genetically engineered using DNA technology. Since it's not made from human blood, it has no ability to spread viruses. Other treatments include desmopressin, which stimulates the body to release more clotting factor 8. Hemlibra prevents or reduces bleeding episodes in those with hemophilia A. Antifibrinolytics help prevent clots from breaking down. Fibrinolytics normally break down clots once the injury starts to heal, so antifibrinolytic medication prevents clot breakdown and blood loss. There are many complications associated with hemophilia. Deep internal bleeding can cause limbs to swell and press against nerves. Bleeding in the neck or throat can inhibit the ability to breathe. Joint damage may occur if internal bleeding puts pressure on the joints, which can lead to destruction of the joints. Infection may occur after treatment with clotting factors, since there is an increased risk of viral infections if it came from human blood. Adverse immune reactions may also happen post-treatment, if the immune system negatively reacts to clotting factors used to treat bleeding, which then stops the clotting factors from working effectively. There is no way to prevent hemophilia since it is usually from an inherited defective gene. However, complications can be prevented or alleviated by 1. Having annual checkups at a hemophilia treatment center. 2. Getting vaccinated for hepatitis A and B. 3. Treating a bleed within 1 hour to prevent long-term damage. 4. Exercise and maintain a healthy body weight since strong muscles protect the joints. And 5. Get tested regularly for blood-borne infections.